Welcome back. Our time running low tonight, so we're going to go rapid fire with some of your popular COVID-19 questions for Dr. Thomas, like this one. We got a lot of this, Dr. Thomas. If you've had coronavirus, COVID-19, do you need to still get the vaccine, or are they treated any differently than somebody who hasn't had the virus?
My recommendation is that you do get vaccinated, even if you had COVID. And the reason is, number one, in both of these trials, they vaccinated well over 1,000 people who had been previously infected, and the vaccine was safe and it was highly effective. Number two, we do not know after a natural infection how long you are protected. And number three, we do know that people can get infected a second time. Fortunately, it's happened infrequently, but it has happened. So for those reasons, I would recommend that you get vaccinated, even if you've had COVID.
Will people have to take a COVID-19 test before receiving the vaccine?
No, they will not.
Dr. Thomas, does the vaccine have a different impact on different ethnicities?
So they really tried hard in both of these trials to enroll a very diverse group of people. The majority still ended up being Caucasian or white, so that was about 80% of people. They had about 10% of people were African Americans, about 4% of Asian heritage, and then smaller numbers thereafter. And what they saw was that safety was the same and effectiveness was the same across all of those groups and across all age ranges.
Any concern, Dr. Thomas, that people are going to let their guard down now that the vaccine is being distributed?
You know, that's always a concern, right? And unfortunately, not wearing masks reliably and gathering outside of families and, you know, immediate family and immediate pod, this is the reason that we're in this situation that we are now. So, you know, can it get worse? Yes, it can absolutely get worse if there's even greater relaxation of these public health behaviors.
I've seen several people ask this question. Can you choose, assuming the Moderna comes in next week, would you be able to choose, I want Pfizer, I want Moderna, or do you kind of, when it gets to that point, obviously it's still a ways off, you get what you get?
Yeah, so the short answer is I don't know the exact answer, but my speculation is because of the fact that we do not have enough vaccines to vaccinate everybody as quickly as we would like to, I believe that there's probably not going to be overlap in, you know, different vaccines in one institution for the same population of people. So I don't really think that you're going to have a choice. I think where you get vaccinated, they will have the vaccine and you'll either take it or you won't.
You know, it's so important that people have to buy in. They got to trust the science. What's your message to people expressing concern or doubt about the vaccine?
You know, my message is that people educate themselves and that they go to reliable, objective, you know, disinterested sources of information, and that they go to more than one of them. You know, this is not a time for you to you know, kind of go into your group think tank on social media and have people who are not, you know, experts or people who do not know what the facts are give you advice, because the stakes are just way too high. So I would say educate yourself, go to more than one source of information, have a discussion with your medical provider, and by doing that, you'll be able to make an informed and educated decision about whether you should be vaccinated or not.
How does this, it may be a little bit sciencey, but how does this protection work once you get the vaccine? Does it prevent you from getting it? Does it make it lesser in you? How does it actually protect us all?
You know, I mean, these are all very good questions. That's a really good question because a vaccine can do a couple different things, right? So a vaccine can prevent infection. That's a very high bar. A vaccine can prevent you from getting sick, right? Which is what these vaccines have shown that they can do. And then a vaccine could also prevent you from being able to transmit to somebody else. And really, we've only proven the middle. We've only proven that these vaccines can prevent you from getting ill. The other two things we have, although plausible, we have not proven that. And which is one reason why people need to continue to wear masks even after they get vaccinated, because you know the vaccines are not 100% effective. They're 95% effective or 94% effective, which means there's still a 5 or 6% chance that you won't be protected by the vaccine, which is why you should keep wearing a mask.
Right, and okay, everyone wants to know, when can we breathe again?
Well, you know, I think that if we can have a reliable rollout of vaccine, number one, number two, and just as important, that people actually take the vaccine in large numbers, right? If we really need to achieve about 70% of the country, 70% of the eligible people accepting the vaccine and taking the vaccine. So if those two things happen and people drastically improve their wearing of masks and not gathering, we could have a very good summer next year.
Dr. Stephen Thomas, we cannot thank you enough for spending this time answering our viewers' questions. We know we didn't get to all of them. We did the best we could, and we'll have you back again to keep asking you questions. And we appreciate you so much for being with us tonight. And we have more information for everybody on localsyr.com, the full interview, all of your questions, and the answers from Dr. Thomas. Thank you so much.